helping make your life easier. Moms Every Day.
Hey, welcome to Moms Every Day. I'm Hattie Cheek. Today we have Stephen Woolums with us, and we are going to be talking about something that people don't typically enjoy discussing. Now, bladder control issues. Is it a widespread kind of thing?
It is. Urinary incontinence is the involuntary loss of urine, and it affects a lot of people, and a lot of people suffer in silence because of it.
Now, what exactly is it?
Well, it's just what it is. Urinary incontinence is the involuntary loss of urine. So a person knows they have something in their bladder, and then it just leaks out before they want it to.
Now, how often does this happen?
It really can vary depending upon the severity. Sometimes it can be only when you cough or sneeze, and sometimes it can be just any time.
Does it happen to everyone as they age? Because I know that that's something people probably worry about happening as they get older. So is that the case?
No, it's really not. A lot of people think, well, if they get older, they're always going to wet on themselves, but that's not the case. Urinary incontinence does affect select people. As you get older, the incidence does go up. But it's not a natural history of aging.
It's not a natural thing, so you won't necessarily, won't necessarily happen to you. But what are some different types?
When you look at incontinence, we first have to look at bladder function. The bladder has two functions: it stores and it empties. When you leak without wanting to, when you have to go to the restroom really bad, that's called urge incontinence. When you leak, when you cough or sneeze, that's called stress urinary incontinence.
Okay, and so we've seen a lot of commercials, that whole gotta go kind of thing. Is it always like that? What is the deal? Well,
it was popularized by commercials, by industry. Gotta go is called overactive bladder. And it is just that. You see people who have such bad incontinence that they go into a mall and they find out where the restroom is before they can do anything else. It affects about 17 to 20 million Americans, so it's very common.
Okay, and so what may a patient expect if they seek treatment for this?
Well, when you look at the treatment for overactive bladder, urinary incontinence, you have to first decide, is this urge incontinence or is it stress incontinence? If it's urge incontinence, then we go through an algorithm. We first try to change behavior. We try to look at a person's diet, what they're drinking, what they're eating, to see if that can cause the incontinence. So simple behavior modifications can fix a lot of it. The #1 irritant in the United States is caffeine, and a lot of people indulge on caffeine, and it causes them to have irritated bladder, and they leak. And all you have to do is change that, and it gets better.
But that's tough for some people who really drink coffee every single day.
But that's part of my education, is we have to teach them that, hey, that's a problem. And sometimes you have to adjust your behaviors. If the first line of therapy, behavior modification, doesn't work, then sometimes you have to do medicines. And medicines will help control the bladder by relaxing it and allowing it to be a little more capacious.
Okay, and what kind of interventions are there for this stress related?
Well, if you have leakage that when you cough or you sneeze, then what you're trying to do is you're trying to improve the leak point pressure, making it harder to leak. The standard of care nowadays is called a mid-urethral sling. That can be done with a single incision where we support the urethra so that when you bear down or you cough or you laugh, then the urine doesn't leak out the urethra.
Now, when it comes to the stress, when we're talking about that one in particular, is that an age thing, or can kids have this? Or what's the age range there?
Well, stress incontinence often occurs in women after they've had a baby.
Okay.
Or if they've had some type of pelvic surgery. We see stress incontinence in men when they've had their prostate taken out because of prostate cancer.
So it all makes sense. It all has to do with when something severe is going on down there, and that can happen afterwards. How severe can this be for women who've just given birth? How long does it stick around?
Well, it can be a lifetime issue if it's not addressed. A lifetime
issue.
Yeah.
And if it's not addressed, you said.
That's correct. If it's not addressed, sometimes it can happen just temporarily and goes away. But a lot of times, as the baby is coming out of the canal, it can affect the nerves and the muscles that support the urethra and the bladder, and the only way to stop it is to surgically repair it.
And for many women after having a baby, it's a great time, but then it's also a tough time. So when things like that start to happen, I'm sure that they get a little down on themselves and they just don't know what to do.
As I said earlier, women and men suffer in silence because of incontinence, and it's something we're trying to raise the awareness of so that there are treatments, there are ways to fix it.
Well, great. Thank you so much for joining us. If you want any more information or you have any questions about this, just head to our website, wsaz.com, click on the Moms Everyday link, and make sure that you download our app at Moms Everyday. Thank you for joining us this Thursday. Have a great day.